tab here, and I'm just going to log in. After you go through the login screen, you're presented with a blank page. Again, for privacy, we try not to display a list of patients, and so it just shows you a blank screen, and then you'll pull up the patient. So let's pull up a sample patient. I made a sample patient, Amy Lazarus, my wife. None of the information here is true, but you can search for a patient, and you can pull up any patient that you want. And then here's there's a few different ways to get around the patient chart. Here, this will take you straight to a general area of the chart. I can go straight to the dispensing, or straight to the chart itself, or the tests. And once you pull up a patient, then it's going to draw up a new menu on the left. So the general structure of this is all the information you're working with is in the main window. On the left will be a menu that's customized, both for the person that logs in and for the patient that's been selected. So suppose we select Amy Lazarus. I just click on that chart button. And let me walk you around what just happened. First of all, this entire left menu just regenerated, and there's a few things. You can go back to patient search where we just were. Here it's showing you whichever picture you ask them to show, ask the computer to show, and you can just snap pictures with the tablet that you're using to check people in. And then this is what I call a quick peek. So from anywhere you're at in the chart, you can peek into all the main chart areas right from here. So let's say you're writing a note and you forget about their medical history. You can go ahead and view their diagnoses just by mousing over. And this works great on a tablet too, so you're not jumping around between windows. Or you want to see their medication list. So that's what I call quick peek. Chart is going to be any general areas of the chart, vital signs and weigh-ins, RD and MD notes, and so on and so forth. Tests are anything that we did, labs, urinalyses, EKGs, body fats, PHQs for depression screening. Communications is any type of communication, either between you and the patient or with staff. So patient messages, staff orders or staff to-do, flags, letters, exporting notes. If you have a HIPAA compliant request for chart notes, you can generate a chart note export, or looking at the patient's food journal. We probably included communications. Scans and pictures, a full-featured dispensing module, graphing. So that's all specific to this patient. When we go down from that, we'll talk about all that later, but that gets into practice-wide features, practice management, a help system, a resources system, and so on and so forth. So anytime you open up a patient, the first thing the computer does is looks through all of the tables, and it generates a customized header for that patient. And these headers can be customized, so they might look different for a dietitian or a front office versus a physician. There's various options we can use for this header, but I have it set up a way I really like it. So up here it shows me allergies. Here it shows me their initial and their current vital signs and weights. It tells me how many weight loss programs have they done. If this is a patient I saw 5 years ago and came back in now, we might call it weight loss program number 2. So this patient's on weight loss program number 1 for a little over a year. On the right, I have the patient's medication list and primary and secondary diagnoses. Flags is basically yellow stickies, things that you can have pop up on the chart, reminders about that patient. This tells me their meal plan, what meal plans did the doctor approve them for, what was the last lesson they got, and when are they due to see the doctor. This patient's a few months overdue. Then comes my favorite part of the whole patient chart, which is system messages. So in system messages, the computer will go through, and based on a set of rules, based on the patient's gender or meal plan or age or medical diagnoses or medications, it looks at all sorts of things, and it generates recommendations up top. So for this patient, it recommended that I be aware that they have metabolic syndrome, and it tells me which risk factors it saw to come up with that diagnosis. And it tells me I'm missing some informed consent documents that it thinks I should be getting inside. So I don't have to do that, but that's the computer. Because our office does medication dispensing, one of the big things that happens up front is we don't know if a patient has refills left, if they've expired. So the patient chart will look through all the active prescriptions, and it'll say how many refills are left, whether they're expired or not, when they expire. So this one expired 10 days ago. This one we have a while left on. We'll talk more about dispensing in a little bit. Below that, so that header is going to be common on all pages. And then below that, here we're getting our actual vital signs. And then when we go into the chart, it gives you all the sub-tabs just as another quick way to get to all these places instead of going through that left menu. It takes you to the same place. And so in Amy's vital signs, you can see what kind of visit that they had. MD visit, a weigh-in, a cancel. We track cancels in case you want to charge for that cancel, for example. You do that for billing purposes or just to see that the patient canceled. You can see which food plan they're on, and we color-coded them, what the weight was, blood pressure, and so on and so forth. So to add information to the chart, you can do this with a tablet or with a computer or a laptop or a phone. It doesn't matter. You just click Add. And then it's going to just ask you for the fields it needs, and then it calculates most of them. So let's say this patient's doing an MD visit. It pre-populates whatever their last food plan was, or you can change it. If you change it in the MD or RD note, it can update here as well. And you can enter whichever information that you did. And then it goes ahead and adds that to the table. And so you see, anytime you do a transaction, it just takes a couple seconds. And what it did is it went ahead and while it was populating this, it calculated the body mass index, it calculated their total weight loss and the weight change from the last visit. So from the last visit, this patient gained 3 pounds, so that came up in red. And it added a billing code. We did a body fat percent, and it added a billing code for that we use in our office, 93.07, so we'll make sure the patient got billed for that, unless we're doing it as a no charge for whatever reason. There's actually more information than what you see in this table, so you can view all the information that was calculated if you'd like. So in addition to all of that, because we entered a body fat, we have the patient's BMI change, body fat percentage change, calculated their fat and lean weight, goal weights, and it does a metabolism calculation based on different levels of activity. So there's actually quite a bit of information that was calculated. So that's how you'd enter vital signs. Again, it just takes a half second.